Good afternoon. It's an exciting day.
Good afternoon, Doc.
Today I have the pleasure of speaking with Dr. Pierrot. Dr. Pierrot runs our Alabang branch here in Alabang. And so we're going to have a conversation about yourself,
Great.
chiropractic, the impact you're having here in Alabang. So first off, Doc, why don't you tell us a little bit about yourself and how you got here to the Philippines?
Okay. Well, first, it's also a pleasure for me to talk about all of this with you, Doc, today. Well, I'm a Swiss-French chiropractor. Been studying in Paris first, and practicing in Switzerland, Hong Kong, and now I'm in Philippines for the last 2 to 3 years. Yeah.
Great. Okay. So what brought you to the Philippines?
Well, what brought me to the Philippines was, well, first I would say that was one of my favorite destinations in terms of travel for vacation, especially when I was in Hong Kong. I was traveling here a lot. I fell in love with the islands, the people here, and also visited some chiropractors like you, and I really loved the relationship with the Filipino patients, and yeah, I was really impressed by how things here.
So you were practicing chiropractic in Switzerland or in Paris?
I practice in both places. I started in Paris after just my study, but I quickly moved to Switzerland, and then I've been to Hong Kong, and then because of the pandemic, I had to go back to Switzerland, and here I am.
Right. Okay.
Yeah.
And so ultimately, we had initial discussions, I believe, in 2019.
Yes.
Right.
Yes.
So you were kind of interviewing chiropractors. You
Yes.
had to decide who you wanted to work with.
Exactly.
Right. And so just tell us how it is you came to choosing me and why.
Well, I would say first the vibes of the person, and also the way you work was definitely aligned with my philosophy, how I see a chiropractic care. I like the fact that you really emphasize on the well-being of the person and not just thinking about pain. Another thing I was appreciating is not overuse the X-ray, MRI, all of those lists, things which can be sometimes a bit scary for the patient. Doesn't bring so much addition most of the time, of course. I'm not talking about special red flags or special diagnosis, but which really match with my way of seeing a care, let's say.
So you brought up, our philosophy, and a lot of people don't really know what that means. Maybe you can elaborate on, the different styles of chiropractic and
Yes.
chiropractors.
Yeah, there's, I don't know if we can count it, but
Right.
there's more than 100
So many.
different techniques in chiropractic. I believe the one we both use are pretty common, especially in USA. There's other technique of chiropractic which are maybe more energetic. Sometimes they don't even touch the patient, or other technique where they use more instruments and things, or other techniques where they definitely focus more on pain. So they're gonna add some PT modalities, etc. And I guess, I wanted to focus mostly on the spine, where we have the most efficient results so far.
Yeah, I mean, I think in simple terms, there's two ways that we can go as a chiropractor. You're either going to kind of treat pain or you're going to recommend more of a long-term approach.
Sure.
It seems the majority of chiropractors in the world are more in the pain paradigm, and a lot of that has evolved over the years because of insurance.
Yeah.
That's what pays.
Exactly.
Insurance pays for pain relief, not for wellness care.
Yeah.
And so, especially in America, a person's going to get a certain amount of sessions paid for. It's only very few to get rid of their pain. And so that's really what's evolved. And one of the things I love about, what attracted me here and made me fall in love with chiropractic here in the Philippines was, we don't have that insurance headache. It doesn't have that obstacle in the mind of the patient.
Yeah.
Insurance creates that obstacle.
Yeah, but I didn't realize that when I visited, of course, Philippines. It's more when I practice with you that I realized, that's much, much better. And I realized the difference with Switzerland, where, because of insurance, you're kind of forced to focus more on pain, try to really think short term and being as fast as possible in short term, without really thinking long term, as we can do it more here.
Yeah. And so personally myself, over the 24 years I've been doing this, we our philosophy is more a wellness-based, long-term approach so that we prevent problems from occurring. You know, people develop pain because they have some type of stress on their spine, some type of a postural misalignment. And of course, we can alleviate that through the adjustment. But if we only see a few times, it's going to be temporary. And so the reason that the pain always comes back, of course, is because you still have stressors in your life.
Of course.
And so, you know, I'm under the belief that, you know, I get adjusted regularly so that I can care for my spine and my nervous system. And this is where Filipinos are still learning about. They're still learning that, oh, there's this way that we can really prevent these problems. And that's what we were excited about coming here, was like, hey, we have this model that isn't really known about. And so that's one thing that I really excited about.
Actually, it's like I can, when I was back home, I was adjusting my family regularly every week.
Yeah.
Which you cannot really do with the patient because they kind of limit with the insurance and everything, unless you open their mind more about the long-term approach, which is definitely easier to do.
Yeah, in America, I still preach that way, even though it's so insurance-driven. But yeah, I would lose people because, hey, I love you, doc, but I want to use my insurance, so I'm going to go to the guy down the road. But I still did practice mostly cash practice, still preaching these long-term programs. So it still can work. It's just, it's like swimming uphill.
And the great thing is we can do those package also for people who really think long term and really can have better price also for their sessions, which, for example, in Switzerland, I cannot do that.
Right.
Yeah.
Yeah, and so that's one thing, you bring a good point. We offer these discounted packages so that people can get the care that they need. So, Doc, I want to touch upon, like, you know, one of the things that is so important to me. There's a few things that are important when I'm hiring a doctor, because, you know, definitely I get approached by a lot of doctors throughout our time having multiple clinics, and I actually turn several doctors away because they don't match the criteria that we're looking for. Obviously, a person needs to go to chiropractic school, right?
That's
That's obviously very important. So there are chiropractic schools abroad, America, Europe, Australia. There unfortunately are none here in the Philippines, and that's why majority of us are foreigners, right? And so it's important that one went to chiropractic school so they get that proper knowledge, so they can diagnose properly when a person comes in, so we don't injure somebody, right? Second thing is they need to have the same type of philosophy, which we just touched upon. We need to have the same belief. I don't really want my doctors to be preaching pain relief. We want to be preaching, let's change your health, let's change your life, let's get rid of your symptoms, and more or less just really correct the problem. Exactly. So you lined up with that. And then the third thing is you must be an excellent adjuster. So often I would get adjusted by certain docs wanting to work with us, and I didn't feel the adjustment. And there's obviously a lot of that goes into that. Adjustments dictate your result, and if you can't adjust, your results aren't going to be very good.
Totally true.
And so you really lined up with all those three criteria. You know, you're a great adjuster. You're great to work with. So can you touch upon the importance of, you know, adjusting and having good adjustments?
Well, to me, it makes me think, because I was doing karate before, and I was actually a France champion of karate 4 times when I was young, and also get my black belt and everything. And that was funny how you can do a lot of hours training with the same people, but definitely different results at the end. So yes, of course, the degree is important. Having your black belt still means something, but doesn't necessarily mean that you're at the top, let's say. Yeah.
That you're a badass.
Exactly. And I'm sorry, when you have a good technique in karate, that makes a difference.
Yeah.
Yeah. And sometimes small details makes a big difference.
Yeah.
And that's really how I see things. And yeah, I mean, a lot of chiropractors are amazing, and I'm sure everyone can find the chiropractor they like and which match with their expectation, etc. But definitely, yeah, with some, when I was at school, I was always the assistant of the teacher, and that, I think, is a sign that, okay, maybe I'm good with my adjustment, I don't know, but that's...
it's really important.
Yeah, of course.
It dictates the results
definitely
of a person's going to get. You know, we have, you know, a variety of different shapes sizes of people. We have big patients, we have elderly, we have babies. So it's so important that you're choosing a chiropractor with the proper skill that can take care of you, that can adjust you, not hurt you.
Yeah.
Right.
And also, like you say, we can adjust so many different profile. And that's important.
Yeah. So Doc, you've been doing chiropractic now for how many years?
I was out of school in 2016, so now it's 8 years.
8 years, okay. And as you know, with experience, you just continue to get better and better.
Yeah, that's practice makes perfect.
Yeah, and then you're experiencing a lot of miracles here in your clinic?
Yeah, well, the more you see patient, of course, the more miracles happens. Well, I don't have everything in head, but I think one of my favorite miracles, which already happened like 3 times the last year, was the Coda-Equina syndrome.
Coda-Equina, okay.
For people who don't know, it's like a very, very severe sciatica stage where it's kind of, you have to go to surgery at this stage.
Because there's usually bladder issues.
Yeah,
right. There's direct pressure on the nerve and usually disc bulge.
Yeah, exactly. And they almost, they are in the limit with the weakness in their legs and almost cannot work properly. And so as a professional doctor, I have to say, okay, well, you have to go to emergency now, and you have to do the next step is probably surgery. But I'm not saying that so people do the same, okay? But I had a few patients who, of course, was, let's say, not very listening, but still wanted to continue with me, and also I think didn't want to spend that much with the surgery.
They wanted to try something before, which is
so I
smart.
kind of tried to find a middle ground and say, okay, well, you're coming back tomorrow again, and we do 2 sessions a day. If we don't see any improvement fast, I'm sorry, I don't see you again. You have to go to surgery.
Because that's what you were taught in school.
Exactly, yeah. And after, I think, it's already 2 cases like this. One is a little bit different, but 2 cases like this really last year, which was amazing, like how they could improve. And
so they surprised you.
Yeah, because it was maybe going against what I was
conservative, and the schooling's gotten more and more conservative, especially in Europe, right? It's very conservative,
more and more medicalized.
Medical. So these are things that we do experience all the time. I've been doing this now 24 years, so I'm more like open. Hey, let's do everything. Let's try this, because I know I've seen it. These miracles happen, and we can prevent the surgery.
I think that's a big difference. You have this experience, which I'm still going there, and I'm still a little bit hesitant, but the amazing result we can have make me more.
Isn't that incredible? Someone, is needed for surgery, but they get these adjustments and they no longer need that. Right? People come in wheelchairs and they leave walking. Right?
That happens to me once. Yes.
It's incredible. Pregnancy. How about, have you helped anybody get pregnant?
Pregnancy, that's definitely not the patient I see the most.
No, meaning someone comes in because they're having a hard time getting pregnant.
I had that. You never really know if it works because of you or not, because I just had a few cases really ask for this. But I want to believe it worked. But I could.
You'll start to attract that more and more as you're going in your practice.
Yes.
Those are things that really happen. How about babies?
Babies, I see more and more babies. And that's really impressed me. Like recently, we have a baby who always has a head like
this.
A
torticollis? Or?
Yeah, but
just
it's
a
more
head tilt.
Kind of a habit, like often. She can be normal, but she was doing that
This
often.
is a common reason parents bring their children, yes. Okay, so what happened?
So basically after a few, I think about 5-6 adjustments, not 100%, but like 90-80%.
And so for people wondering, well, how does this good for babies? Babies also have spinal misalignments. Oftentimes the birthing process can be quite traumatic. Babies are falling asleep on their belly, so their head is rotated. They're crawling. So these are all stressors that the baby's going through, and so the adjustment will alleviate that stress through a natural form of healing. We just basically allow the body to heal. So we do these gentle adjustment on a baby, and it releases that interference, and the nerve will tell that muscle to relax. So that's how we help with torticollis or head tilts. So it's really great for children. Yeah. Any other stories that you'd like to share?
Well, the common story is mostly about back pain most of the
Right.
time, of course. So, is there any miracles there? I would say, I think what touched me the most is people who tell me how much we change their life.
Yeah.
Like, sometimes they cannot do any sport of the activities they like, basketball, piano, whatever,
Yeah.
and then they can go back to their normal life. And sometimes it's like that for many years, and sometimes they have been told that they shouldn't go back to those type of activity. And I think everything is possible. The body has really an amazing ability to adapt, and when we give the chance to the body, miracle happens.
So chiropractic is really a lifestyle.
You get it.
Yeah, right. Yeah, okay. Well, thanks, Doc, for that. So let's touch on a new subject here. Let's talk about why is it that you love living here in the Philippines?
Well, like I said, I love going on weekends on the islands. Well, right now it's a rainy season, but so far that's one thing I really like, the beaches here around. One thing I like also, I would say, is how nice are people, how more resilient they are, more less headaches sometimes, let's say. But depends on what also. But for sure, what also I enjoy here is the activities, which are definitely cheaper compared to Switzerland. I mean, Switzerland is one of the most expensive places in the world.
So the cost of living is a lot lower.
The cost of living, yeah, definitely make a big difference. That's for sure. Of course, I have my girlfriend, Filipina, which is also a reason why I'm here.
So you're really laying down roots here in the Philippines.
Yeah, we can say that.
That's awesome.
Yeah.
What's your favorite food?
My favorite food, well, if I say adobo, I will sound too cliche, but
But it's so good.
yeah, it's good. Let's say kare kare. I like kare kare.
Yeah, very good. Okay, final question, Doc. Why is it that you love practicing as a chiropractor here in the Philippines?
Why is it?
That you love being a chiropractor here in the Philippines?
Well, I think it goes back to the initial question. I guess the fact that there is less paper to write, let's say. If I compare to Switzerland with all of those insurance things, I was sometimes spending 60% of my time writing documents instead of seeing patients.
So you're helping more people.
Exactly, much more. And
right.
The practice is much more enjoyable.
Yes,
yeah.
It's very enjoyable. We help a lot more people here. Without doing that paperwork, we're able to serve more people, help more people.
Of course, regulation is needed at some point, but over-regulation is just just too much.
Well, thank you, Doc. I really appreciate this time and educating people about chiropractic, your life here in the Philippines, and how you're making a big difference. So thank you so much. I look forward to years and years ahead with you. Thank you.
Let's do this. Thank you so much.
Let's get adjusted now.
Yeah, let's do it.
Back pain, headaches, sciatica, these are all signs that your body's not operating optimally. Chiropractic is the most effective way at improving the body's function. So here we are. We're going to do our adjustment today on Dr. Pierrot here in Alabang. Let's get in here. Let's breathe and exhale. Good. There you go, right there. This is the one. Very nice.
Thank you so much.